Medicaid paid for at the beginning the rest of that pregnancy, and it paid for his birth and for his first two open heart surgeries. I see every single day kids whose entire lives at home with their families is funded by Medicaid. Private insurance only does so much, if you even have it.
That was Allison Chandra. She's the mother who spoke to us earlier this week about how Trump's mega bill would impact her and her family. According to the Congressional Budget Office, millions are expected to lose their health care now that Congress has passed the bill with cuts to Medicaid. And Allison joins us now. She's a pediatric nurse whose son Ethan has a rare genetic disorder and relies on Medicaid for treatment. Allison, I do want to talk to you as a medical professional, but first I want to talk to you as a mother. Now that this bill has passed, what is the thing you're most concerned about losing access to?
I told myself I wasn't going to cry about this. It's all so fresh. I just sat with my kids and watched this vote. Watched Congress, who has completely abdicated their moral high ground, who has no courage to do right by our disabled children. I'm not worried as much for my son right now because he doesn't rely on Medicaid anymore. I am worried about the millions of kids across this country who do. Kids like the patients that I care for. I was just at one of my patients' houses last night. I was finishing up my charting this morning while I was watching them debate whether or not Medicaid's even going to still be around for me to be able to provide her the care in her home that keeps her with her family.
Can you talk to us about, you said your son doesn't rely on it so much anymore, but he has in the past, and what it's meant for your family to be able to have the support of Medicaid, and if you can just give us some of the specifics of things it provides for your patients, including the one you were just talking about.
Yeah, absolutely. So Medicaid, we had no income, my husband and I, when I got Ethan's diagnosis prenatally. We had been volunteering for nearly 6 years overseas, and Medicaid is what allowed us to confidently move forward in choosing life for him. And that life has not been easy. Medicaid paid for a difficult birth. It paid for his first two open heart surgeries. We're about to mark the anniversary of the first one that happened 6 days after he was born. It paid for all of that, and we were able to transition into private insurance. And we don't rely on Medicaid right now, but a lot of the families, most of the families in the disability world that I'm connected to, rely on Medicaid for things like feeding supplies, incontinence supplies, medications, wheelchairs. The list is endless. It's everything that a disabled child needs to thrive in their lives. Medicaid pays for that. Medicaid makes that possible.
All those little things, anybody who's ever had surgery know they all add up so quickly, and so much of it is not normally covered. And for Medicaid to cover that, I would imagine makes such a difference. When you're dealing with parents who are making these catastrophically difficult, heartbreaking decisions for their child's health care, when you were dealing with these decisions yourself, what kind of a burden does it compound to then have to worry about how you're going to pay for it? Should that be something that someone with a sick child has to worry about in America in this day and age?
No, and it's unconscionable, honestly. When I said we were volunteering overseas in some of the poorest nations in the world. So I've seen firsthand what lack of access to healthcare looks like, the way it compounds disease, and it makes things so much worse. And to think that we're fighting that same fight here in the richest country in the world, that's a moral failure.
Allison, is there anything else you want us to know about how you think this is going to impact your family or your patients before we take a quick break?
I want every single Republican lawmaker who voted for this bill to know that we are not stopping fighting. It's all we know how to do. We've been doing it for our children since the day they were born, and we will not stop. We will keep showing up. We will keep speaking out and telling our stories because our children's lives matter.
Allison, our best to you and your son, Ethan. Thank you for joining us.